After a successful surgery to remove a cancer-ridden section of Jeff Moroso's large intestine, the oncologist sat down with his patient to prepare him for what was to come, 12 rounds of chemotherapy. In total, his doctor instructed Moroso to take more than a dozen prescription and non-prescription supplements. Moroso said the first 3 rounds of chemotherapy were more awful than he could have imagined. He felt ill and weak, he could hardly stand up, and the prescription drugs just made it worse. Moroso couldn't afford to take off from work for chemotherapy, so he got his doctor to write him a prescription for the medical marijuana. By the 7th round of chemo, after taking the medical marijuana, he had dumped his prescription pills. Moroso is now 70 and cancer-free, according to Medical Marijuana 411. Medical marijuana has been used as a medicine for thousands of years, dating back to ancient civilizations in countries such as Europe, India, Africa, and even the United States. I think about everyone can relate to someone you know being sick with some type of illness. Today, I would like to try to persuade you to consider the facts stated and spread the word on the benefits of medical marijuana. With that being said, let's first discuss the illness, the illness and sickness medical marijuana can help. Medical marijuana, use it or not. I'm all for the use of medical marijuana. Hearing the word marijuana, some people visualize recreational, which is for fun, and not the medicine. It's also used for several sicknesses and diseases, such as glaucoma, anorexia, cancer, HIV, hepatitis C, Crohn's disease, diabetes, epilepsy, fibromyalgia, PTSD, Alzheimer's, and Tourette's. And that's not even the whole list. Susan Trossman, an RN with MS, stated, "I'm not promoting the use of illegal drugs, and I'm not discounting the value of pharmaceuticals. But if marijuana can ease people's pain and suffering, why not let people use it?" The main ingredient in marijuana, which is THC, is already FDA approved and marketed as Marinol. It is a pill form used to treat weight loss, nausea, and vomiting. It's a man-made form of cannabis, which is also referred to as marijuana. Studies confirm that 10 milligrams of THC is equivalent to 60 milligrams of codeine. While any medicine has its benefits and risk, weighed out, scientific studies and risk show potential health hazards of marijuana are far better than the hazards of most prescription drugs. Now let's discuss the science of marijuana and the effects it has on the body. Its toxicity is used to explain the biochemical events in both acute damage and in slowly progressive neurodegenerative disease. Evidence of studies show by injecting the main ingredient, THC, that the cannabinoid system can serve to protect the brain against neurodegenerative disease. Some of those include stroke, brain injury, Parkinson's, Huntington's, Alzheimer's, and multiple sclerosis. These studies are shown by the Society of Neuroscience. The basal ganglia, which coordinates the body movement, is part of the brain that is responsible for the neurodegenerative disease. Because of the defects in the basal ganglia, marijuana's calming effect is what helps bring relief to the neurodegenerative disease. Medical marijuana also affects the the hippocampus receptor in the brain, which is responsible for learning, memory, and response to stress. The normal biology and behavior associated with the brain areas are constant with the behavioral effects produced by the cannabinoids, according to Joy Jennett, which means taking the medical marijuana as opposed to not taking the medical marijuana, the brain is about the same thing. According to WebMD, a survey shows that oncologists and hematologists show the highest level of acceptance to the medical marijuana at 82%, saying medical marijuana delivers real benefits to patients and should be used as an option. During an interview with WebMD, Dr. Smith states, one of the documented uses of medical marijuana is the treatment of pain. Medical marijuana may be a better painkiller than most narcotics, such as oxycodone, with a lot less potential for addiction than narcotics. Now that we have discussed the science and effects on the body, let's discuss the solution. The most logical solution to the problem at hand, which is legalizing medical marijuana in all states, would be to spread the word about the benefits of medical marijuana, and contact your state government or organization and give them your input on the subject. Finally, I would like to explain the benefits of medical marijuana. One of the main benefits is that it would help people who are sick with pain, nausea, vomiting, and loss of appetite. It also helps protect and relax the brain against neurodegenerative disease. One of the main chemicals in marijuana, CBD, may help prevent cancer by help cancer from spreading by turning off a gene called ID1, according to California Pacific Medical Center in San Francisco. According to the National Cancer Center Institute operating under the U.S. Department of Health, marijuana kills cancer cells. Cannabinoids may inhibit tumor growth caused by cell death, blocking cell growth, and blocking the development of blood vessels needed by tumors to grow. Cannabinoids kill cancer cells while protecting normal cells. A 6-year-old girl from South Carolina is suffering from pediatric epilepsy. Before she begins treatment with cannabisol, Mary Louise is suffering more than 100 seizures in a 45-minute session. After only one dose of the cannabisol, her seizures dropped to 19 in a 45-minute session. That's an 81% decrease. A 54-year-old woman was diagnosed with stage 4 lung cancer and was given 6 to 9 months to live. In little time, it had spread to her lymph nodes and her chest. The doctors began chemo with no success. With nothing left to lose, Kelly decided to try the cannabisol and began to take small doses orally several times a day. Within a few months, her tumor had shrunk from 5 centimeters to 2.1 centimeters, and her lymph nodes had returned to normal size. The fluid around her heart was no longer visible, and after 7 months of using the cannabisol, Kelly's scans showed that she is completely cancer-free. Now that we have discussed the diseases medical marijuana can help, the science of marijuana and the effects it has on your body, the benefits and the solution, let's take action. I would like to ask each of you to pass on the information and educate other people about the importance of legalizing medical marijuana in all states. You can also contact an organization in Kentucky called Legalize Kentucky Now at legalizekentuckynow.com or write them at P.O. Box 5742, Louisville, Kentucky 40255. In conclusion, let me say this. People have seen loved ones suffer with sickness and disease while they render helpless. While medical marijuana may not cure everything, would it not make a difference to give these people some kind of relief from pain and suffering? Let's do our part and make sure everyone has the opportunity to choose the option of medical marijuana if the need arises.